Renal oncocytoma is a benign epithelial cell tumor that arises from the collecting ducts. Grossly, it appears as a well-circumscribed mass with a central scar. Microscopically, it is composed of large eosinophilic cells with abundant mitochondria but without perinuclear clearing, which helps distinguish it from chromophobe renal cell carcinoma. Clinically, it presents with painless hematuria, flank pain, and an abdominal mass. It is often resected to exclude malignancy, such as renal cell carcinoma. Nephroblastoma, Wilms tumor, is the most common renal malignancy of early childhood, typically occurring between ages 2 and 4. It contains embryonic glomerular structures and usually presents with a large, palpable, unilateral flank mass, hematuria, and sometimes hypertension. Wilms tumor is associated with loss-of-function mutations in tumor suppressor genes WT1 or WT2 on chromosome 11. It may occur as part of several syndromes. WAGR complex, Wilms tumor, aniridia, absence of iris, genitourinary malformations, and range of developmental delays caused by WT1 deletion. Dennis-Drash syndrome, Wilms tumor, diffuse mesangial sclerosis, leading to early-onset nephrotic syndrome, dysgenesis of gonads, male pseudohermaphroditism, and WT1 mutation. Beckwith-Weidman syndrome, Wilms tumor with increased organ size, organomegaly, macroglossia, tongue enlargement, hemihyperplasia, imprinting defect causing overexpression, omphaloceal, and is associated with WT2 mutation. Urothelial carcinoma of the bladder, also called transitional cell carcinoma, is the most common tumor of the urinary tract system and can occur in the renal calyces, renal pelvis, ureters, and bladder. It typically presents as painless hematuria without casts. Risk factors can be remembered with a mnemonic PSAC. Phenacetin, smoking, tobacco, aromatic amines found in dyes, and cyclophosphamide. Squamous cell carcinoma of the bladder arises due to chronic irritation of the urinary bladder, which leads to squamous metaplasia, dysplasia, and eventually squamous cell carcinoma. Risk factors can be remembered with the 4 S's. Schistosoma hematobium infection, endemic in the Middle East, chronic cystitis, smoking, and stones, chronic nephrolithiasis. It also typically presents with painless hematuria without casts.